Good morning. Thank you for joining CCN, Connect Care Network. This is Consumers Doctor, Dr. Bengala. Today, let's talk about freedom. The last segment I spoke on the freedom, I really thoroughly enjoyed it. I liked it. Let's explore that. Freedom. We all care about, Americans love to be free. They don't want to be hindered by anybody. It doesn't matter, public or private. They don't. Look at the scenario now. Every time the Medicare enrollment comes, have you seen you're bombarded on TV with Medicare enrollment ads? Do you guys have any idea what as a business guy, I would do the same thing. I want to make money. Yes, you understand? Insurance companies are here to make money. They're not serving the public. Come on. They're not. They're here to make money. Tell me one insurance companies, this is where I have a problem. Tell me one insurance company is focused on the consumer. Give me one example, one insurance company. They don't. They all want to make money. I understand free enterprise system, folks. I understand all that. They are doing the right thing, going after chasing the dollar from federal government, state government. They want to see the so-called Center for Medical, CMS, Medicare services. They give them the contracts to these insurance companies and even some of the providers who are taking full risk. CMS gives them monthly income so that they can take care of the folks like you and me. But what amazes me is CMS doesn't trust you or me. It doesn't. They want to give it to somebody in the middle. Why is that? Why don't they trust the Americans? This is what it doesn't matter, policymakers, it doesn't matter who wins the election, it doesn't matter Republican or Democrat. CMS, Center for Medicare Services, so-called CMS, and HHS, Health and Human Services. I have been tweeting left and right, even AARP. If they're looking at this channel, they need to seriously think about freedom for Americans. Healthcare has never been free. They have never done a damn thing. Yes, they have never done a damn thing. What they do is they assign or they give the burden to somebody else. What the Medicare CMS is doing, they give the burden to another organization to take care of your problems. Why don't they give the choices to you or me? I want to have 5 to 10 choices to make from the so-called insurance companies. That's why I'm seriously looking at setting up personalized health insurance. This is where insurance companies, they need to be loyal to the American folks. They need to come straight up front. Why do you see bombarded with all these Medicare enrollment ads? So-called Medicare Advantage is not an advantage. It's an HMO. They want to limit your services. So-called managed care services, they want to limit it. They say, oh, free dental, free eye, free this, free that. Come on, that's a bunch of bull. They want to take your money and curtail the service. That's the only way they can make money. This is where Americans need to wake up, man. They need to wake up. They need to wake up. See what's going on. We need to have freedom to choose whichever plan you want. We need to choose whichever is giving me basically health disclosure, healthy pricing. It's called HDHP. I want to have HDHP accounts accessible to all Americans, irrespective of if your employer subsidized, government it doesn't matter. Medicare, Medicaid, even indigent. I want to have a choice, man. I want to have a choice where I can choose where I can save money. Representatives in Congress and in the Senate and even the president, if you're listening, we want a freedom in healthcare. How do I get the freedom? No matter what you guys do, I can bet you Americans are coming after you. They want freedom in healthcare. They should be able to choose their doctor. They should be able to choose their facility. They should be able to pay the bill. We don't want any surprise medical bill. This medical billing is fraud, man. It is totally fraud. What Medicare has given this artificial numbers, CPT, DRG, they are not the right numbers. They just cooked up in the books. They print up all the CPT, DRG, and these billers copy that and they bill you. And Americans are getting frustrated with bankruptcy, surprise medical billing, and healthcare is becoming a nightmare. And everybody is blaming everybody. Insurance companies are blaming the hospitals. Hospitals are blaming the doctors. Doctors are blaming the insurance companies or lawyers. Doctors are blaming the lawyers. And consumers are being shafted. They are being shafted. This is my problem. We need freedom. How do we achieve the freedom? No matter what you guys do in Washington, Americans will fight it and they will get it. They will expedite that day. There I can choose my own health disclosure, healthy pricing, which is under your control. You can choose that. I want everybody to try hard, try to get HDHP accounts open. That will qualify you for Health Solutions Advantage. This is the way it works, folks. If you're healthy, you should be in the well category, and your premiums have to be damn lower. Then you should be able to put money aside into your Health Solutions Advantage, where HSA, you can save the money every month. You can, if you're an individual, can put $300 aside. If you're a family, you can put $750 to $800 aside every month. Instead of paying the traditional premium, participate. Health disclosure, healthy pricing, that will qualify you to set up Health Solutions Advantage, folks. That way you can save money, come out ahead. It doesn't matter. Don't trust the Washington anymore, because we are getting so frustrated with every time I see this advertisement on TV. They want government's money. They want to grab it, and they want to cut down your service. Oh, they're saying, oh, free dental, free eye. That's such a false thing. If you have HTHP with HSA, you don't need all that, because you have your own money to spend. You don't need to depend on anyone. You are on your own, man. You are on your own. I'm telling you, all the families to embrace HTHP, HSA. I renamed the HTHP to Health Disclosure, Healthy Pricing. It's no longer, you have a deductible, but that deductible came in handy. And this is where I would like the government to assist. We have 20% of them are lower income. They have no possessions. 15 to 20% of Americans don't have any possessions, don't have anything. Give them free life insurance. Give them, government can. How much does it cost? $10-12 a month? Come on. I see insurance companies offering me $100,000 for $10-12 a month. Government can do that. Why is the government? Democrats, if you are listening, if you really want to help the poor, give us the life insurance for people who are in the lower income bracket. Give us $100,000 coverage. Along with that, you can include the medical benefit, just in case for unforeseen medical bills. You can be a part of the package. If person has too much health issues or whatever, that should cover for that unforeseen medical expenses. They can easily provide a health insurance for 15 to 20% of the population. This is what India has done, folks. India has given free health insurance to 50 million Indians. We can do that? Come on. America is wasting 3.88 trillion and 18.5% of the GDP on stupid things, on healthcare. They're wasting money, man. They're not doing any favor. They're wasting every year. I see Americans are losing patience. They want to be free. They want to take care of themselves. Give them the tools what they need. Representatives in Congress, Senate, and President, if you're listening, and AARP, American Medicals, listen to me. Give them the tools what Americans need. Give them the choice of the insurance company. Give them the choice what they need. If you do like this channel, subscribe the channel, and I'll see you in the next episode. Thank you for joining. This is CCN, Consumer Connect Network. Consumer Care Network, I'm sorry. This is Consumers Doctor Bengala. Thank you for joining again.